Hi, good afternoon, everyone. Thank you so much for joining us this afternoon. I don't know about you, but today has been a very busy Monday. So I hope you all have had some time to relax during the session, at least on the weekends. Things are really heating up with the General Assembly right now, and it's getting kind of busy, but we have a lot to catch up on today. We're really glad to see so many folks joining us. For those of you who don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the ThriveKY campaign. We're always delighted to host our quarterly forums with the Cabinet for Health and Family Services. We're also today combining that with our monthly state and federal policy updates. You may recall that we do these forums quarterly, and our February forum we had to cancel at the last minute because of some scheduling conflicts. And so we're going to do a little combination here today, and hopefully we can make that work out pretty well with the timing. But our last forum was in November. It's hard to think back that far, but that was right after the kickoff of open enrollment and the relaunch of Connect. Which was really exciting at the time to have our state-based marketplace back in place. And we now have gone through our first open enrollment period with our state-based marketplace, and we'll get to hear some updates on how that went, what plans are for improving Connect, and getting ready for our next open enrollment that will happen this fall, and lots of other things that we're going to catch up on. We really appreciate always having leaders from the Cabinet for Health and Family Services joining us for these discussions. On our call today, we have Deputy Secretary Carrie Banahan with us, DCBS Commissioner Marta Miranda-Straub, DCBS Deputy Commissioner Lisa Dennis, the Director of the Division of Child Care, Sarah Vanover. And hopefully I haven't missed anyone, but we will, with these forums, our goal is always to have more open dialogue with cabinet leadership, consumers, and advocates. We really want these forums to be an opportunity for you to get the latest information on the state response to COVID-19, updates on our safety net programs, public assistance programs, and share feedback, ask questions. We want these always to be very useful to you and the work that you do. And Kelly, why don't we move forward a slide? I know most of you are familiar by now with the ThriveKY campaign. This is something we discuss on all of our monthly calls, but for those of you who may be joining us for the first time, our core purpose is to meet the basic needs of every Kentuckian through systemic change. And we have been really focused on these policies that are both anti-poverty and anti-racist, because we know that Kentuckians have faced historical and systemic barriers to meeting their basic needs. And we believe that if we are going to have a thriving Kentucky where all Kentuckians have their basic needs met, we need these types of policies in place in order to have a more equitable and just Commonwealth. And so what you see on this slide are the principles, the core principles that we share and that really guide our work. We can go to the next slide. These are the members of our coalition. Go to the next slide. I want to always thank our sponsors for making these monthly webinars and forums possible. United Healthcare, Anthem, and Humana have all sponsored our work this year to make sure that not only can we provide these monthly webinars for free, but we can also provide CEUs to social workers, licensed social workers, and to certified community health workers. So thank you all very much for that. We can go to the next slide. And here's our agenda for today. So I mentioned that we are going to be doing a combination of our forum to begin with, and then our state and federal policy updates as a second part of our agenda. And these are the topics that we're going to be covering today. So we will be starting off with our forum, and the first topic that we have on our agenda is outreach, enrollment, and Medicaid updates. So I'm going to hand it over to Deputy Secretary Banahan, Kara Stewart, and Priscilla Easterling.
I guess you want me to start off. Sometimes Priscilla or Kara, you all kind of tee it up, or
Yeah, I think that Karen, Priscilla can tee this up, and Kelly, why don't we take the slides down while we have this part of the discussion, and we'll bring them back up when we do our updates. Thanks.
Sorry about that. I was trying to come on camera, but it was just not wanting to work. Sorry about that. Hi, everyone. I'm Priscilla Easterling, the Outreach Coordinator with Kentucky Voices for Health. I'm super excited to have Deputy Secretary Carrie Banahan here with us to give us some updates about health and family services. Thank you for coming. Thank you for joining us.
Well, you're very welcome. So open enrollment began on November 1st and ended on January 31st. Happy to say very successful this year. With the launch of a new system, you're always going to have little bugs along the way. But certainly overall, we're excited about the numbers that enrolled. So we had over 74,000 people enroll in a qualified health plan. And during that time, we also had over 25,000 people enroll in Medicaid coverage. Of those 74,000 that enrolled in a qualified health plan, over 62,000 received some type of tax credit to help with their premium costs, and over 12,000 ended up paying a full price for their qualified health plan. We took over 35 applications during that period of time. We also had 168,000 phone calls, and that's just from our Conduent call center. We didn't separately track those calls into DCBS, but I'm sure that was probably tens of thousands of calls as well. And during open enrollment, we had over 8,000 people change plans. So even though open enrollment is over, you can still qualify for coverage and enroll in a health plan if you have a qualifying event. So if you lose your employer coverage, if you lose your Medicaid coverage, you have 60 days through a special enrollment period to enroll in coverage. Other qualifying reasons would be if you become divorced and lose your coverage, if you're married, if you have a child, many various reasons why you can enroll outside of open enrollment. One thing that I wanted to mention that we're excited about, but we're probably not going to be able to make the change probably to this summer, is there is a special enrollment period that the feds allow, and it's available on healthcare.gov. Hopefully we will have it this summer, where if your income is up to 150% of the federal poverty level, you can enroll in coverage at any time. So the income limit for the Medicaid expansion is 138% of the federal poverty level. So if you're in between, you can enroll in coverage for a zero cost plan. Any questions?
That's really exciting. I just saw the announcement about that SEP being available on healthcare.gov last week. So I'm so excited that Kentucky is going to take advantage of that. I know you said they would not be able to put that into effect until the summer. Do you have an idea like what month we could start to expect it?
We're hoping maybe sometime in June. I can get some additional information on that later. Going to have to check with our IT folks and our vendor as well. So.
Awesome. That's so great. As we hear more about that, I'm sure we'll help encourage people to use that SEP. That is really clutch to be able to apply and have that $0 premium. That's amazing.
And we're already planning for open enrollment 23. So we have our Kentucky Health Benefit Exchange Advisory Board that meets monthly. And under our advisory board, we have subcommittees. So we have an agent connector, a qualified health plan, outreach and education, and behavioral health. So these subcommittees started meeting in February, and they're making recommendations on improvements, on changes for open enrollment 23. If you're interested in coming to our board meetings or maybe being on one of our subcommittees, you can email Karen Cantrell, and she will send you the email link for the board meeting. And then we'll get you on one of the qualified health plans. Or if you have questions, want to talk to me, if you're interested, please let us know, because we certainly need more folks on our subcommittees.
And you said these meetings are meeting monthly, right? These
Right
subcommittee
now,
meetings?
right. So our the board meets typically each month, and then our subcommittees are meeting at least once a month. As we approach open enrollment, it could possibly be twice a month, but right now the commitment is just once a month.
Perfect. And are these meetings public, or is everyone open to attend, whether or not they're on the committee or not?
They are public. All meetings are public. Our Kentucky Health Benefit Exchange Advisory Board meeting, as well as the 4 subcommittee meetings. But to the extent that we have them virtually, and that's what we're currently doing, you'll need a link. And I guess Karen Cantrell, KAREN.CANTRELL.KY.gov. And I'll put that in the chat if you want to email her and attend the board meetings or the subcommittee meetings, let her know.
I think both Emily and Kelly beat you to it. So
did they? Well, thank you. I know it would be hard for me, yes.
No, but if anyone is interested in attending these meetings, or if you would like to join them, it sounds like there's an open invitation. So please get involved. Is this one of the best ways for people to give any feedback about Connect or get involved with that?
Yes. This is the best way for them to be a participant on one of the committees and share their concerns, their voices, or their recommendations.
Great.
One thing that I wanted to mention too is, with this open enrollment period, we had 2 new insurers to the Kentucky market. We had WellCare and Passport/Molina. And WellCare, they offered plans in over 60 counties. And for 2023, I know they're expanding into additional counties. And Molina/Passport offered in 4 counties, basically the Jefferson County area, and maybe Bullitt and Oldham, and I think one more. But they're also going to expand into some additional counties for 2023.
That's amazing. I know that there were a few counties, like the cabinet did such a great job extending the available insurers between 2021 and this year. So it's really great that there are going to be even more options for 2023.
Yes, we're very excited about that.
That's fantastic. Are there any other opportunities for consumers or people who maybe don't have the time to join a subcommittee or attend those meetings to give their feedback?
Certainly, they can email me directly and Carrie.Banahan@ky.gov. If you have any recommendations, any feedback, any issues or concerns, please email me directly. So, and I'll share that with the team and we will get back with you.
That's fantastic. Thank you so much for putting that offer out there. Hopefully people will take advantage. I know a lot of people had a lot of opinions about Connect coming back. And it was a wonderful experience for it to relaunch. And I know that there were some bugs, but the cabinet and you, Deputy Secretary, have been so great about being willing to work through those issues and listen to some feedback about that. So thank you so much for that.
We certainly plan for 2023 to make system enhancements to make the user experience more improved and better. We know things weren't perfect, so we want your input.
Perfect. Is there a timeline that people should shoot for to make sure that they get their feedback in, so that in time by X date so that it can be considered?
As soon as possible, yes. Right now, during the month of March, the sooner the better. So.
Okay, you heard that here first. Everyone, if you have any opinions, any suggestions, do it as soon as possible so that they can be considered for open enrollment 2023.
Okay. There was one other thing that I wanted to talk about is the unwind. So since March of 2020, nobody has been discontinued from Medicaid coverage except for if they moved out of state, they requested discontinuance or death. So, at the start of the pandemic, we had, I think it was maybe 1,250,000 people enrolled in Medicaid coverage. I looked today, and at the end of February, we have 1,615,000 people enroll in Medicaid coverage. And, we were seeing new enrollment, you all. I mean, as I had mentioned, since November 1st, to the end of January, we had 25,000 new enrollments. And really from like the end of January to the end of February, enrollments increased by 12,000. But for those folks, you know, that have been covered, I guess, for over a year, when the public health emergency ends, we're going to have to terminate folks who aren't otherwise eligible for Medicaid. So since March of 2020, we have been conducting passive renewals, checking income, checking eligibility to determine those folks that we could recertify another year. And then there are those folks that had either excess income or they reported a change and we asked them to send in information. Maybe they sent it in and it disqualified them. So as of last week, we had almost 180,000 people that if the public health emergency ended, you know, would be terminated from Medicaid coverage. But of the 180,000, there's around 70,000 of those who would qualify for some types of a tax credit to help with their premium cost on the exchange. And, you know, we're having discussions internally. CMS is providing guidance, you know, but our thinking is, you know, rather than terminate 170,000 people like in a month or two, which would virtually be impossible for us to even begin to do that work and man the phone lines and determine eligibility, it is have that over a 12-month period. So, you know, what we would do is every month we would check eligibility. If the final determination was ineligibility, then they would be terminated, but they would be offered, you know, a special enrollment period for coverage on the exchange.
Wow. Okay. That sounds like a much better plan to try and stretch that out over 12 months instead of just a really short time period. So what's the best thing? What should consumers know? What do they need to do so that they can make sure that they're covered and they don't lose their coverage because they missed something?
Right. So, you know, we'll have outreach and education. We'll send notices. We'll have social media postings. Probably we'll have a press release. It will be on the portal. So when the public health emergency ends, we have 60 days to take some type of action. So certainly we will get the word out there. We'll work with you all. We'll work with other advocacy groups. We'll work with associations. We'll work with provider groups to get the word out. I think people will be aware, you know, and we'll work with everybody because we want everybody to be eligible for healthcare coverage, you know, if they qualify. So.
Absolutely. And so now one of the best things that consumers can do is make sure that they update their address and contact information.
That is exactly right. We need a current, correct address for individuals to notify them and get in touch with them as well. So yes.
Perfect. Well, it sounds like it's an all hands on deck situation when that does happen. Luckily, that's not going to be for another couple of months. Fingers crossed. So
that's our understanding. So yes.
Perfect. So we have some time to plan. Is there any other updates or anything else that you'd like to share?
I think I've covered everything unless you have questions.
That sounds good. Does anyone have any questions for Deputy Secretary? Well, okay. Well, thank you so much for joining us today. I'm going to go ahead and turn this over to Tyler Offerman.
Thank you.
Thank you.
Hey y'all, Tyler Offerman with the Kentucky Equal Justice Center here. Sorry for the scenery. I am in the great state capital of Frankfurt, so hanging out in a committee room. But we are, I believe, Lisa, are you taking over for Jason?
I am going to do my very best, Tyler. I'm not Jason, but I'm going to try really hard.
No worries, no worries. Our normal regular Jason Dunn apparently got bit by a spider, so he is getting that taken care of. So thanks for standing in, and yeah, I would love to just open it up to you for any thoughts or updates you have.
Thank you. So I know there is a lot of questions about where we're at with different things. First, I will update a little bit on the everyone on the emergency allotment piece. currently, where that stands is that as long as there is a state of emergency along with the federal declaration of emergency, those emergency allotments can continue. We have to reapply each month, but that has not been an issue with getting those approvals. However, when the state of emergency ends, or the federal emergency ends, then no longer either one of those emergency allotments will no longer be available. They'll continue for 1 month post the end of either of those declarations. But so right now, our state of emergency is set to end in April the 15th. And therefore we would have May emergency allotments still being issued. But after that, if the state of emergency is not continued, the emergency allotments would no longer be available to us in Kentucky. Also, I know with regards to PEBT, we've been working very hard to get our PEBT plan approved by the feds, and there is still pending that approval as of today. So we can't really talk about a timeline for those benefits just yet until we get that plan approved by our federal partners. And then there will be some implementation work on our side to be able to be offering those benefits, but we're hopeful we're getting very close to an approved plan. I know those are the two big things that we wanted to update on. So Tyler, what other questions do you have for us?
Yeah, I mean, those are obviously the big two that folks ask a lot of questions about. And just to clarify on the emergency allotments, those we are talking about the SNAP emergency allotments,
Yes.
Sometimes also called max benefits, but it brings everyone during the states of emergency, as Lisa mentioned, up to the maximum allowable amount in SNAP, as long as you would otherwise qualify for the program. So unless both the federal and states of emergency are extended after mid-April, because I believe the federal one is set to expire around then as well. So
Correct.
Obviously advocates, folks in the cabinet and folks receiving those benefits are all waiting to see how that goes. But to your point, if either is not extended in April, we get an off-ramp month. So we would get one more month of benefits after that, and that would give us enough time to communicate out to beneficiaries that the change was coming.
Yes, that is correct.
Great. And then, I got a lot of PBT questions, but until the plan is approved by FNS, I know that those are all probably unanswerable until we get the final approval from the feds. The only other question that I had was just how did disaster SNAP go? After the tornadoes out west, there were several different plans, and we're moving into flood season and other storm season. So just a general, how did it operate, and are y'all feeling, well, not good about implementing disaster SNAP, because obviously a disaster would happen and no one feels good about that, but how's the state feeling about our disaster SNAP program?
Yeah, we're currently working with some changes to our system that would help us to more readily respond to those types of incidents as we move forward. So our DSNAP programs, again, we have to work with our federal partners to get those plans approved as well. And it can sometimes, it can take a minute, and when you have a disaster, you don't have time to wait. So we are looking at some opportunities to streamline some of our state internal processes and IT processes, so that it can speed that up and make it more us to be more nimble and being able to respond. And then, of course, working with our federal partners always to try to identify opportunities to streamline those processes is something that we do on a regular basis.
Great, thank you. And then just last question, I've heard that, a couple months ago, call times at the DCBS call center were getting pretty high, low staff, lots of folks calling in. I've heard that the wait time is not as bad as it used to be. I wonder if you could just comment.
Sure. Yes, we did. January was a very busy month. Again, staffing has been a concern of ours for some time now. You've heard us talk about that. We are continuing to look at opportunities to hire staff, onboard them more quickly. We've done a couple of different things around the staffing concerns. And then January was also open enrollment, which required our staff, which increased our call volume. So our wait times in January in December were very, very high. They exceeded an hour. We had a difficult time. We could not answer all the calls during the day, but currently wait times are better. We're averaging around 20-25 minutes for our SNAP call queues, which is our largest call volume queue, and we are answering all of our calls during the day, and there's very few callbacks, if any, are needing to be offered at the end of the day. So that we feel better about. We still know there's work to be done. We want to reduce that wait time. We are working on some different opportunities to staff call services differently and work on our interactive voice recognition, our IVR process, so that it is more user-friendly and we're ensuring people get to the correct person that can assist them most quickly. So those changes hopefully will go in place over the next few months, and we'll see a smoother process there, and we'll further reduce our wait times.
Great. Wonderful. Thank you so much, Lisa. Did anyone have any questions? If not, then I can hand the reins back over. Thank you, Lisa.
Thank you.
Thanks, Tyler. I think that we have the 988 on next with Marcy. Marcy, are you going to cover that?
Sure. Hello. Is anyone on from DBHTID? Not seeing anyone right off. So, okay. So 988 is a mental health crisis line that is happening and actually federally mandated. It is the only legislation that passed unanimously in the Trump administration. So in 2020, that legislation went through both houses of Congress and signed by the president, the only unanimous thing. What our goal with that is to create a mental health crisis service wraparound system. So similar to the way we have 911, but for mental health services. We do have the support of our 911 teams. We have the wholehearted support of our police, our EMS, all of those folks that are involved in 911, as well as buy-in from our community mental health centers and all of our folks on the ground who would end up providing services. So our goal with that right now, we have some budget money that we want to make sure that we keep for 988. So if y'all can put any words in on a private time for that. And yes, hashtag fund 988KY. It's in the chat. We're going to be sharing all kinds of awesome things that way. But we also have a bill in order to put a cell phone fee on. We already pay 70 cents statewide for 911, and that amount varies upwards from there across the state of Kentucky. We are asking for a uniform 70 cent per phone line fee just on cell phones. So not on anyone who's already in a rural area and doesn't have cell phone access, right? We're not going to burden them further with an access issue. But those funds will go toward an actual fee. So this is not going to general fund dollars, cannot be changed without legislative interference as to what it covers. We have set up an independent group of lots of awesome people who will be deciding where that fund money goes. So some great positions in there. So really it'll be, it won't be just a blank check, right? It's going to have some oversight, but it's going to be an awesome thing, I think. I'm happy to answer questions about that. The House Bill 373 is the bill. So House Bill 373, but our message is pretty clear. We need the budget funds as well as House Bill 373. It's going to be expensive. The reason it's going to be expensive, all of our call centers are going to be here in Kentucky. So the 1-800-273-8255 is the suicide prevention line that we now have nationally. we have been working really hard on the ground, and actually I should say give Beck Whipple the kudos he deserves at DBHTID for really working to get us all on that line and get those calls answered here in Kentucky. Because as you all know, Kentuckians speak better to Kentuckians, right? We're understood here. We understand our resources on the ground. The quality of a call service is much more improved when someone understands the accent, understands the culture, and knows what's going on. So we have worked on getting over 80% of calls are already answered here. We're going to try to reach 100%. We may only get to 95, right? But calls are answered in New York and Miami, Florida, otherwise. So that's where our backup call centers are. What we're trying to do is create a system where all of our local answered phone lines are supported, have enough staff members to actually answer the phone, who are trained, have decent benefits, can take a vacation day for their own mental health so they don't end up becoming callers. Right? We don't want that happening. I'm afraid it probably has, because their increase in calls has been astronomical just due to COVID. And then once we start hearing about 988 in the news, right, every time we say it on a news recording, there's a bump up in calls. So as soon as that becomes national news that it's out and everybody knows that easier to remember number, we're going to get more calls, which is a good thing, except that we don't have more operators. And that's why we need the general fund dollars, is to get those more operators right away, because that fee doesn't even start till January 1st of next year. And it's going to take a while to accrue any kind of funds from that fee. So, but yeah, I'm sorry, I've talked a little bit longer than I planned to, but I want to make sure that was clear. We do want to hopefully have people on the ground when on the ground services are required. We want crisis stabilization units, places that are not hospitals, but are clinically approved places for folks to kind of get better, right? Maybe they just need a little bit, someone to stay with them for 12 hours until they can see the doctor in the morning. Crisis Stave is a wonderful thing for that. So just lots of different options that we can launch if we have the funds to do it. And I think there's a lot of people who recognize the need now. And so we're gonna hopefully keep moving forward. So Fund988KY is where you can find us on .org. So House Bill 373.
Great. Thanks, Marcy, for those updates. Does anyone from the cabinet have anything else that they want to share about 988 before we move on? I think our next item is economic updates and status of federal relief with Dustin.
Yes, and we've got some slides for that. If Kelly wants to share her screen and bring those back up. I think there's some after my section as well. Kelly, are you there and able to pull those up? There we go.
Yeah, just bumping up to that point because we'll go back.
Yeah, that sounds great. Okay, so normally we bring up the sort of economic landscape at the very beginning, and we decided to bring that down partially because we had folks from the cabinet we wanted to hear from early on, but also because the sort of current narrative around the economy and specifically workers and jobs is playing really prominently into the legislative session right now. So we wanted to try and do a couple of things related to dispelling some of the discussion around who is and who isn't working, the status of our recovery, and then talk a little bit about what kind of support is remaining for folks who still need it. So just to start out, I want to just be really clear that we are currently experiencing the most rapid recovery on record. We have month over month job growth that's doubling the average of the last 4 downturns. We're bringing on roughly 4,000 people a month. We lost an incredible amount of jobs early in the pandemic, which is one reason why it kind of feels worse than maybe some other pandemics, but we're on pace to really recover the number of jobs that we lost incredibly quickly. Right now, we are about 81% of the way back to pre-pandemic levels compared to where we left off, which means we only have about almost 3% fewer jobs than we did at the beginning of all of this. So that's the first thing I just want to make sure folks are aware of. We are not in the midst of a slow recovery. Workers are not returning to the job, the labor force slowly. People are returning to work incredibly quickly, which is, I think, doubly amazing considering the fact that we're still in a pandemic. We still have thousands of people getting COVID every day. I think on Friday, 45 people passed away from COVID-19. So especially some of these lower paying public facing jobs where you're at more risk of catching COVID-19, it's really remarkable how quickly we're moving back toward something like sort of a labor market normalcy. Let's go to the next slide. And what may be even more amazing than that is that if you are an employer that's paying even decent wages or meager wages, you have recovered in terms of the number of jobs that we had prior to the pandemic. Every job, on average, jobs that pay more than $27,000 a year have now reached pre-pandemic levels. Positions that pay $27,000 or less, those are the only types of jobs that are still waning and are now about 15%, well, as of last August, 15% below pre-pandemic levels. Folks may have heard on the news and in the newspapers this idea of the Great Resignation, where people are quitting their jobs. It is true that there is a high degree of quits, but there's an even higher level of hires. So it's not so much that there is a great resignation. It's really more like there's a great finding a better job going on right now, where folks are leaving lower paying jobs and entering into higher paying jobs. I know that there's been sort of anecdotal complaints about how there are now hiring signs in every window in folks' hometowns. Frankly, I think that's a sign of a healthy economy. When we are bringing on more people and we're providing higher wages to pull people into positions of employment, we want to continue that as much as possible because that really provides the opportunity for a higher standard of living for our neighbors and for everyone around us. So let's move on to the next slide. What we don't want to do is start cutting benefits because not only does that hurt the folks who are directly affected by those cuts, it also affects the local economies where those benefits are spent. So I want to speak specifically about two bills that are moving through the legislature. One is House Bill 4, the other is House Bill 7. People have probably seen the news a lot about House Bill 4. It's a bill that cuts unemployment benefits. We applied the calculation that they used to determine the number of weeks that those benefits would be available, less than the standard 26 weeks, which is what most states in the country provide. And really only in 2 of the 6-month periods, going back to 1990, would we have ever hit 24 weeks, which is the maximum that are allowed under House Bill 4. Most of the time, including during 2020 when unemployment hit 16%, folks would have only had anywhere between 12 and 16 weeks. I think the average number of weeks that would have been available are 14 weeks. That means that cuts benefits by as much as 54%, leaving about, on average, $4,000 on the table. That's money that then is not spent in grocery stores, in Walmarts, on rent, on electricity, which then pulls money out of those folks' pockets and really creates a vicious cycle that could end up with more layoffs. That's especially true in parts of the state where there are not as many jobs. And so you're essentially cutting off more weeks because it takes longer to find a position in those areas. And we're really concerned about what that means, not only, again, for the folks who use those benefits to get by on while they look for work, but also for everyone else around them. The same thing is true for House Bill 7. You'll be hearing more from us about House Bill 7 in the coming days and weeks. We're really concerned about the provisions in it that would cut off things like food assistance and medical assistance. We know that cutting SNAP means that you're pulling money out of local economies. Last year alone, SNAP provided $1.6 billion through food assistance throughout the state. Medicaid is the second single largest appropriation in the state budget behind SEEK. And that money is then matched at about a 4-to-1 ratio from the federal government. And that money goes again into hospital systems and into the economy. So by making the sort of technical changes that create a hostile environment for folks looking for assistance that exist in House Bill 7, you turn people away or you turn them down. And what that means is you pull large amounts of federal money out of those local economies and you hurt the jobs that exist there. But we know that there are ways that we can improve on an already incredible labor market. So let's move on to the next slide. There are 3 groups right now that you could kind of consider outside of the labor. Well, there's 2 main groups in a couple different settings who are outside the labor market right now. The first are retirees. Retirements have increased during the pandemic for a couple of reasons. One, a large share of the baby boomer population is starting to hit over 70, and the largest population who began to retire during the pandemic were folks 75 years old and higher. So those are first and foremost the folks leaving the labor force, people aged 75 years and older. Among prime age workers, which we hear a lot about in Frankfurt and other places, these are folks between the ages of 24 and 55 years old. There is an 80% labor force participation rate. So 4 out of 5 of them are working right now. I've heard numbers around like 50% before. That is not true. 80% of the prime age workforce is currently in a job working. Of that group, the folks who are most likely out of the labor force are moms, and specifically moms of young kids. So while there's an 80% labor force participation rate all around, the labor force participation rate for moms of small kids is around 68%. So the other group that is outside the labor force among that population are folks who are taking care of an elderly or disabled loved one. So if the goal was really to improve on an already incredible recovery, we would not be cutting benefits that could potentially cost other people their jobs and make it harder for the folks who are having their benefits cut go back to work. What we would do is provide higher wages, because we know that folks providing higher wages are having a better recovery. We would provide more childcare, because we know that the primary group who's outside the labor force, who are in the prime age area, are moms of small kids. Or we would build on our home and community-based services so that there were direct supports for folks who are aging or disabled and are being cared by for a loved one. So let's move on to the next slide. Speaking of supports, one of the greatest supports that we saw last year that we know have incredible benefits for whole families, not just children, was the child tax credit. So over the course of 6 months, the federal government provided monthly checks to families with children. It was in whole, it adds up to $3,600 for kids 5 and under, and $3,000 for kids older than that. Half of that was divvied out in monthly checks. The other half is up for being claimed now during tax season. So it also is true that some folks did not receive that funding, and they are eligible for the whole amount right now if they didn't receive it last year. Another really incredible part of the American Rescue Plan Act that we didn't talk about much last year because it was not doled out monthly was the EITC, or the Earned Income Tax Credit. So it was expanded and increased, much like the child tax credit. So it was expanded to more workers and couples. Previously, if you were childless, you didn't qualify. So now childless workers and couples do. And it was increased from an average of, from around $450 to about $1,500. It depends on how much you earn. Obviously, it's an earned income tax credit. It's got kind of a trapezoidal shape. But now workers and couples can qualify with even higher incomes as well. So up to $21,000. It was a lower income limit prior to this, as well as younger workers. You used to have to be a little bit older to be able to receive that. So Both of these tax credits are now available to folks who file their taxes, but that means that folks will need to file their taxes. So if we want to move on to the next slide. There are several resources available for especially lower income folks as well as seniors who need assistance filing their taxes. There are what are called VITA sites, which is the Voluntary Income Tax Assistance, if I remember right. Those are folks who are available to help lower income folks file their taxes. There's also tax prep assistance for seniors through AARP, and we've included a link there. So when we send these slides out, all these links should be live so folks can go find help. And there's also free tax filing websites if folks want to do it on their own, as long as they earn less than $73,000 a year. I would tell folks just be careful, because a lot of these websites will say that they're free up front and then kind of try and trick you into paying money along the way. So the IRS has a list of sites that they approve as truly being no cost to folks who earn at or below $73,000 a year for filing their federal taxes. If you have more questions about the child tax credit or the EITC, I've also included links to those FAQs. And then finally, if we want to move on to the next slide, the other big chunk of federal money that is coming to Kentucky is the second part of the state and local fiscal recovery funds. These are those flexible dollars that are being sent from the federal government, from the US Treasury to the state for use on specific things, primarily responding to the pandemic, providing bonuses to essential workers, preventing cuts in public services because there was revenue losses related to the pandemic, and then finally infrastructure, specifically around sewer, water, and broadband. Final guidance for how that money can be spent goes into effect on April 1st. So far, we've used that money, the first round, on businesses by repaying an unemployment insurance loan that businesses were going to need to repay. Now they will not need to, as well as broadband, water, and sewer infrastructure, and then some COVID prevention that the cabinet has used, and specifically in congregate settings. The state's about to receive another $1.1 billion worth. There's already been some conversation about how that money is going to be spent. We think that, and we can talk more about this later if folks want, that money should be spent primarily on individuals who still have significant needs and are facing significant hardship. There are specific ways that the state can do that, and we are encouraging the General Assembly to move forward with those types of opportunities. So with that, I will stop and hand it back over to Emily.
Thanks, Dustin. We're going to do one more topic with our cabinet guests, which is around LIHEAP and LIWAP. And so Adrian is going to lead that conversation for us.
Hi, everyone. I'm Adrian Bush with the Homeless and Housing Coalition of Kentucky. And we figured with the winter months going on and concern about fuel adjustment rates and everybody's utility bills seeming to be going up, we would take this opportunity with the cabinet, with DCBS, to have them provide any updates on LIHEAP and LIWAP programming, just as a refresher, and if there are any new things that we should be aware of as advocates and folks working with people who may be behind on their utility bills. So I believe Lisa Dennis will be talking, and I'll turn it over to you, Lisa, to just share whatever you think is relevant.
Thank you, Adrian. Currently, we are operating our LIHEAP crisis component, and that will operate through the end of March or until all the funds are expended. And then our cooling component for energy assistance begins on May the 2nd. So those are our timeframes for those two for the LIHEAP programs. And eligibility for LIHEAP is based on 130% of the federal poverty guidelines. So for example, for a household of 4, a family could earn $2,871 per month and be eligible for LIHEAP benefits. And the the water, the live web, well, I can't even say it, the live WAP, the water assistance piece, that began in December of 2021. And it is managed at the state level in coordination with our community action partners, who, as you all know, subcontract with our community action agencies across the state. And that programming can provide relief to 3 priority groups. And those are households facing disconnections or reconnections, and then households with arrearages, and households with a current amount due. And then that program operates at 150% of the federal poverty guideline. So again, for a household of 4, the monthly income could be around $3,468 a month. And we currently have 310 utility providers across Kentucky that are participating in the LIWAP water assistance program. And while that funding is approved through September of 2023, we do expect that our funds will be expended around the end of April of this year. So April 2022 is what we're anticipating to have those of what we, based upon our current spend rate, to see those funds exhausted.
Thank you very much. One of the things that we keep reminding folks of is if they are renting their home, that they want to continue to, if they're in what we call the balance of state, the 118 counties outside of Lexington and Louisville, that utility assistance and arrears and forward payments can be made through the Healthy at Home Eviction Relief Fund, because we really do want to try to make sure that this one-time money, which was passed through ARPA, is used to the greatest extent possible.
Yeah. Yes.
That's all I have. Thank you so much.
Thank you.
Thanks, Adrienne, and to all of our guests from the cabinet. We really appreciate you taking the time to join us today. And I know that there has been a lot in the chat. If anyone here participating in the webinar today has questions or our cabinet guests that you want to either put in the chat now or send to us, we can make sure to get those questions to them later and put any follow-up in our email that we send out after these webinars. But we are going to now transition to the other part of our agenda, which are our state and federal updates. And of course, everyone is welcome to stay on and join us for those. We had the agenda up earlier when at the beginning of the webinar. We could pull that back up again and just get a refresh on what we're going to be covering. So you can see we're going to start off with our General Assembly update. But before I turn it over to Dr. Schuster, I just wanted to say, I mentioned briefly that we do offer CEUs for licensed clinical social workers and for certified community health workers. I forgot to mention that if you are interested in those CEUs, to email Kelly, and Kelly can put her email in the chat. And we do, of course, send out a follow-up to these webinars with all of the materials and any questions that were asked or answers that were provided, any materials shared. So you'll be getting that probably tomorrow sometime. So I'm going to hand it off to Dr. Schuster and Kara to give us an update on what's happening with the General Assembly.
Thank you very much, Emily, and good afternoon to you all. And thank you to the folks from the cabinet for being with us for the first half of our forum today. Just to remind you, we're in a 60-day, that's considered the long session. We're actually more than 2/3 of the way finished. So if you've already been successful with your bill, and there are very few bills that have passed both chambers and have made their way to the governor's desk, you're probably celebrating. For those of us who are still working hard to get some things passed and also playing some defense, depending on what day of the week it is, it seems like it will go on forever, and then it seems like it's going too fast. So included in that time frame before they adjourn at midnight on April 14th is a 10-day veto period, March 31st to April 12th, when there is no session. And that's the period where the governor can decide whether to sign a bill into law, whether to let it become law without his signature, or to veto the bill. So they've gotten a lot done. When we had our first forum back in January, I guess, we talked about they were going to have to do redistricting. They've done those maps. However, the House and the congressional maps are currently being litigated. They moved the filing deadline for candidates from January 7th to January 25th. So we now know who will be running. And you could go to the Secretary of State's office. That's sos@ky.gov. And they have the listings for the House, the Senate, the Supreme Court districts, and the congressional candidates. They extended the emergency pandemic period to April 14th. They did that just the day before it was going to expire. So it was going to expire on January 15th. And on January 14th, they extended it to April 14th. There is a bill that we will talk about in a few minutes that's trying to end it sooner than that. In an unusual move, the House introduced its budget bill before the governor even gave his budget address, and then moved it very quickly. So House Bill 1 is the budget bill, and it's gone over to the Senate for their revisions. And we're expecting to hear those perhaps as early as the end of this week. They took some preliminary action on tax reform, which passed the House after much debate, and is now over in the Senate for them to look at. If you're interested in this, and I really urge you to go to the Kentucky Center for Economic Policy, to their website, and look at their analysis of what would happen to our budget if this bill were to pass. They also made significant changes in unemployment insurance in House Bill 4, and Dustin alluded to some of those. Again, a lot of debate on that. A lot of the Eastern Kentucky legislators, both Democrats and Republicans, were very concerned about shortening the time period for getting benefits and so forth. So a lot has happened. Most of it with controversy, I would say. So if we can move to the next slide, please, Kelly. So we're styling some of these bills as what we call good news bills because we think they're good policy. House Bill 1 so far looks good. It keeps Medicaid and SEEK, which is the education funding, intact. It addresses the retirement or pension costs for the quasi-governmental agencies. There are some asks that a number of groups are making on the Senate side. We need more funding to put more mental health professionals in the schools. We're asking for a school nurse in every Kentucky school all day, every day. We're asking for funding of a farm to school fund that would make food much more available to school children and their families. We have an excellent bill, House Bill 44, that passed out of the House without a single no vote and is over in the Senate, and it would allow an excused absence from school for mental health issues. Marcy talked earlier about the impact of COVID on our mental health, particularly in terms of anxiety and depression. And this bill actually came at the request of a constituent from Eastern Kentucky, of Representative Bobby McCool, and in Jefferson County, a constituent of Representative Lisa Wilner. Both high school students, and both had the wherewithal, talk about budding young great citizens and advocates, to find out who their representative was and to reach out to them and say, we need to have an excused absence from school for mental health issues. House Bill 174 was a bill that was languishing for a while, but it got some additional co-sponsors and now has really moved quickly. This is policy that we have been advocating for lots and lots of years. and it would extend Medicaid coverage postpartum for 12 months. We had a sign-on letter where a number of organizations, I'm sure, participating, both in terms of giving information today and listening, signed on to a support letter for that. House Bill 373 is the bill that Marcy talked about that would make the 988 line sustainable and would make sure that we've got the man and woman power to answer those calls locally. Again, let me emphasize how important it is to get people connected locally, not only to have a trained ear to listen to them, but also to hook them up with crisis and other services that they might need. House Bill 525, I'm looking at Emily because this is something that we have worked on for a lot of years, and that's to make community health workers, I think we always have a number of CHWs on our calls, eligible for Medicaid reimbursement. And we thank Representative Moser for taking the lead on this. This was a working group, included the cabinet, and has many other pieces, but I think from our standpoint, the sustainability of community health workers to be eligible for Medicaid reimbursement is probably the most significant. Senate Bill 8 is an excellent bill from Senator Julie Rocky Adams, and it would improve the state child abuse and neglect prevention board, would add some missing members to it, would give it more teeth. Unfortunately, Kentucky continues to rank #1 in child abuse and neglect, and we really need to get a handle on this, folks. So Senate Bill 8 would take us in that direction. Senate Bill 102 defines additional mental health professionals. This comes out of the school safety and resiliency bills, Senate Bill 1 and Senate Bill 8 in previous legislative sessions. And the school guidance counselors were named in there, but this would add the school psychologists and the school social workers. In a separate piece, we're hoping for funding for additional school mental health professionals. And then finally, and this is dear to my heart, I've only been working on this for 20 years. I'm hoping it's going to happen. Senate Joint Resolution 72 adopts the recommendations from the Severe Mental Illness Task Force and would direct the cabinet to establish a Medicaid waiver for folks with severe mental illness that would give them supported housing, including respite care and supported employment. Those are the two things that would be most helpful in keeping folks in recovery and keeping them out of jail, out of repeated hospitalizations, and out of homelessness. So those are our good news bills. There are other good news bills, but these were at the top of our pecking order. Unfortunately, there are bad news bills, some of which you've heard referenced already. House Bill 4 that revamps the unemployment insurance system in negative ways, the most significant of which is to reduce the number of weeks that they would get benefits and the amount of job searching that needs to go on. I think there also is a requirement that they have to take any job that's offered to them, which we think is a real problem in terms of what that wage might be, not a living wage, and whether it's even something within their scope of experience and so forth. House Bill 7 issued a number of calls to action on this, creates significant roadblocks to Kentuckians to keep their staff, their food security, and to keep their Medicaid benefits. You heard Deputy Secretary Banahan talking about the number of people that need to get recertified. And we know that the more steps, more hoops that we have people go through, the more likely they are to miss one of those and to lose those benefits. House Bill 8, I mentioned earlier, is the so-called tax reform bill from the House. It moves us from an income tax-based system to a sales tax, creates enormous holes in our budget going forward. House Bill 21, which is awaiting a final vote in the House, would prohibit mask mandates in daycare centers and in schools. And we think that this is not in keeping with the science or the recommendations of the CDC. It has 10 amendments that have been filed to it. So we're hoping that Kara, thank you. This should have been corrected. That's actually House Bill 51, not House Bill 21. And we'll correct that before we send it out to you all. So House Bill 51. House Bill 23 would prohibit transgender athletes from participating in women's sports. And if you saw that testimony on the Senate version of that, which is Senate Bill 83, some wonderful young students who just came and said, all we want to do is to play soccer with our friends. And it was really heartbreaking to see how they were being treated with this legislation. House Bill 739 would create such a problem for us hiring social workers because it allows criminal and civil actions against our Department for Community-Based Services social workers, regardless of the fact that they're carrying out assigned duties and removing children in danger of abuse or neglect. Senate Bill 138 is one of the anti-critical race theory bills. It limits instruction in Kentucky middle and high schools on race, religion, and sex. Interesting testimony against this. A number of students of color came and testified against this, and some interesting research presented by Dr. Stephen Nifley from the Kentucky Psychological Association on the negative impact on mental health and on academic achievement when students are prevented from really getting the information they need for racial and ethnic identity. And then finally, Senate Joint Resolution 150 would prematurely end the state's public health emergency, would end it even this week. And we are not ready for that, folks. When we look at the recertifications, when we look at access, and when we look at professionals that are working in Kentucky from other states under these emergency licensure board orders, we don't want to lose those people. So those are our bad news bills, and we welcome your attention to our calls to action. We have been busy, as I mentioned, on House Bill 7. Kentucky Voices for Health has put together just bullet points of why this is really bad policy in terms of 1.6 million Kentuckians who are using Medicaid and 500,000 Kentuckians using SNAP. So we hope that you will flood the 1-800-372-7181 message line. Call often. You can call more than once on a given bill, and the switchboard people will help you get it to your House and Senate members. So we ask you please to weigh in and let your legislators know how problematic that legislation will be. And then finally, this is how you stay connected. You know that you can watch all the action live streamed or archived on KET or the LRC YouTube. You can sign up to get our Kentucky Voices for Health newsletter, register with the legislative message line. It takes about 2 minutes the first time, and then after that, it's about 30 seconds literally to get your message across. And then you know how to identify your legislators on the LRC or legislative website. And somebody asked Emily if you would put the KVH call to action in the chat, please. And I think that's it for me. Is it, Kelly?
Yes, ma'am.
All right. Thank you very much. Sorry I had to talk so fast.
Hey everyone, I am back. We're going to talk about open enrollment and Medicaid renewals. Again, I'm Priscilla Easterling, the outreach coordinator for KVH. Next slide, Kelly, please. Thank you. So the federal public health state of emergency was renewed in January through mid-April. The Biden administration did promise states to give them a 60-day notice before ending the PHE. That deadline would have been February 15th. We have not heard anything, so everyone is assuming that that means that it will be extended. We are acting as if it will be, so we expect that to be extended mid-April through mid-July, and we don't know after that, but we at least one more renewal. As Deputy Secretary Carrie Banahan mentioned, once the PHE ends, they have to start working on the Medicaid renewals. So one of the things that you can do proactively is to make sure that your contact information is updated in your Connect account. Make sure if you've moved, if you've changed anything, your phone numbers, emails, any of that in the last 2 years, just make sure that it is updated to the most current information. It's going to be all hands on deck with people reaching out and trying to send information. MCOs are beginning to send out letters, letting members know that renewal will be coming up. So you just want to make sure that your information is updated so that you can get that and make sure that there are no gaps in your coverage at all. And if you have any questions or any concerns about that, feel free to reach out to me, or you can talk to any connectors who can help you update that information as well. So for open enrollment, as we heard, that ended at the end of January. There are still opportunities to get health coverage if you don't have it. Medicaid is always open. You can always apply. Either for Kentuckians who are under 65 with incomes at or below 138% of the federal poverty line, you can apply anytime. There's an annual change period for if you an annual MCO change period that runs October 15th through December 1st, unless there's cause. So if you enroll in Medicaid now and you choose something and you don't like it, you want to change your MCO, you can do that in October 15th, beginning October 15th, or at any other time if there's a reason that you need to change that. So just keep that in mind. The state-based marketplace through Connect, that open enrollment begins November 1st and will run through January 15th. For 2023 coverage, 2022 coverage, open enrollment is closed, but there are still special enrollment periods available based on like life changes and exceptional circumstances. So marriage, divorce, births, deaths, if you move, you can always get a special enrollment period based off of that. And then you'd have 60 days to apply and get enrolled in a plan. You can access your SCPs and shop and compare plans all in the one-stop shop that is Connect. And if you have any problems or if you have any questions, you need a little help with that, you can always go through a connector because we're here to help and happy to do so. Next slide, please. Here are the current available MCOs that are available: Aetna, Anthem, Humana, Passport, United Healthcare, and WellCare. They all have various added benefits, and there is a side-by-side chart that is really helpful to help you figure out what MCO might be the best for you. Next slide. And here are the available QHPs on the marketplace this year. Like Carrie Banahan and I talked about earlier, they were able to extend the number of issuers this year. Anthem, CareSource, Molina, and WellCare are what's available. And it sounds like next year they're going to be offering even more coverage, covering more counties. So that's exciting as well. Next slide. And so these increased subsidies, again, they are available through the end of 2022, unless Build Back Better in whatever form passes. But right now, there are still those enhanced subsidies. So if now is a great time, if you have not shopped, if you have not enrolled, if you haven't checked it out, just go play around and see what's available for you and see how affordable it really is. These enhanced subsidies over the last year, and that will end at the end of this year, have saved an average of 40% nationwide. So there, again, has never been a better time to look through the marketplace. And we're very lucky to have it all in the same one-stop shop that is Connect. So definitely worth checking out if you haven't. Next slide, please. And then there's also PE. So Kentucky currently allows for 2 PE periods within the calendar year. It is still available. The application is available at a public site that I've linked here. It allows for 2 months of coverage. That's the month of your application and the following month. You can apply for PE anytime throughout the year, if you are uninsured, under 65, and if your income is at or below 138%. For a family, that's about $36,000. PE is managed by United Healthcare, and when you apply, it covers, like I said, the month of your application and the following month. And if you would like it to turn into permanent Medicaid coverage, you just have to apply for full Medicaid by the end of your PE period. Currently, there are about 2,000 to 3,000 Kentuckians who are currently covered through PE, and PE coverage is not automatically extended. So you do have to go back and apply. And that should be it. Thank you. Turning that over to Tyler. And if there are any questions, please feel free to drop them in the chat.
Great. Thanks, Priscilla. So I'm Tyler with the Kentucky Legal Justice Center. Just a couple comments, updates here, some of which we already went over, but just good to check in on SNAP enrollment numbers. We continue to have just about 500,000 folks enrolled in the program statewide. You can see that is down from participation rates at the height of the pandemic, which is, well, it's bad, obviously, that we had a pandemic, but good that SNAP is working the way that it should be and catching folks who are falling on hard times to be able to make sure that they can keep food on the table. So next slide. And again, already talked about this a little bit, but we discussed that SNAP emergency allotments continue. Those depend on the state of emergency and the federal state of emergency, both of which are currently set to expire in April. On our next webinar, we hope to have a more concrete update on those going forward, but as of right now, they continue and would continue till at least May. Some other information there on the slide that's helpful just as far as getting your benefits. I know that we're pressed for time though, so we can go to the next slide. PBT, this is something we constantly get questions about, and unfortunately we are unable to answer them. The state and the federal government through FNS at USDA continue to go back and forth on the state's application, and we are hoping, praying, wishing for that to get finalized so that way benefits can start going out. At this point, it's not beyond the realm of reason that benefits would start going out at the very end of the school year. So, you know, you can go to the next slide. Just waiting on that. So hopefully we'll be able to give you all more of an update in the future. But until then, you can hit enter. Just save your PBT card. You know, they may issue benefits on the card that you already had. So yeah, go to the next slide. Yep, breeze through it. If you have any questions about that, please do reach out. Otherwise, I'll hand it over to Marcy.
Sorry about that. I'll had a legislator call. Let's see. We already talked a little bit about 988. So just remember House Bill 373. Transition deadline is July 17th, 2022. So it's coming. So please don't call 988 yet. But if you need the line, it's 800-273-TALK. Go ahead and go to the next slide. We can skip all that part. This is again about House Bill 373. So we'll skip that one as well. Youth mental health right now. I wanted to get real serious for a moment and talk about that. I have heard from my own child who is 8, who's in this picture, and also many, many other parents have been calling us and emailing, trying to find some mental health resources because kids are stressed out. And we want to make sure that we gave you a few tips to deal with that. So a couple of things to remember. It is okay to talk to kids about hard things. And if you are not in a place where you can do that, then you probably need some help yourself. That is a heads up that you need to find a way to talk about it for yourself first as well. When we do talk to kids, though, we do need to take our cues from them. Don't over-explain, which is one of my mortal sins. Respond factually and calmly. Try not to be too emotional to their questions, and get to the root of the fear if they are afraid. So the reason I say all of that is because our kids have been through a lot, right? Between COVID, the racial injustice stuff that was happening, tornadoes, floods, and now a war in Ukraine that they're hearing about at school, right? Or hearing about in other places. So just keep a mind to be calm, you know, when you're going to have these conversations, and take that moment. Also, map out a routine and stick with it. Routines help all of us feel safe. They really kind of lull your brain into a sense of safety, and that's a good thing because we are generally safe right now. Assess the situation with your kid though. Here's some signs to look for. Changes in eating habits that are a lot less, a lot more. Maybe they only want certain comfort foods, especially if they're younger. Stomach aches, interrupted sleep from nightmares, if you're having a lot of increase in that. A tense body at all times. If they're withdrawing from family and friends. Now, teens withdraw regularly, right? So this is more than usual. Angry outbursts. Again, our kids are growing, hormones are strong, more in increased intensity or in frequency. An increased need to cuddle or other forms of affection can also be a heads up that they really need to check in with you. It may not be necessarily a mental illness stage, but it's a check-in moment, right? And those are also all normal reactions to trauma. If they last between 4 to 6 weeks, that's not a major concern. But if the symptoms or behaviors persist, then you might need to have some further assessment if your conversations aren't really helping them. Sometimes it's really good to reach out to either the school system. A lot of our school systems have a mental health professional now, or you can reach out to your community mental health center. If you need access to services and you don't know where to go, please call us at MHA Kentucky. That's not a problem. Also, stop doom scrolling yourself and your child. Limit screen time, especially news consumption, including on social media. So unfortunately, my kiddo found out more about Ukraine watching YouTube this weekend than he did by talking to me, because it came through on some of his YouTube commercials. So wanted to give you all a heads up that kind of news stories and stuff like that are in places that we didn't normally see them when we were kids, right? He's essentially using YouTube as TV. So just letting you know that. And also, like, it's not good for any of us to get stuck in a loop, right? That 24/7 news cycle can be really tough on anyone and their mental health. Also, it really does help to be a helper. Donate to a charity, and even if it's not in Ukraine or Russia, or if it's not related to the floods and things that are on your mind, donating to some charity can be helpful. Write letters to survivors. Help clear up rubble, help remove mud from someone's house. Whatever you're able to do, become a helper. So many of us have heard Mr. Rogers say, look for the helpers. And that is a very good way to frame a situation in the front. And the next step would be to be a helper yourself as well. We've got other tips like that and resources that I've shared on our Twitter, and I will put those in the chat here as well. Go ahead and do the next slide. If you are finding out, you're not sure what's going on, whether you or your child is having some symptoms, you kind of want to do like an online search. Our screenings are an extra place to go. They are clinical screenings that might have been done in a mental health professional's office. So please go ahead and go to mhascreening.org, take a screening. They're 24/7. They're available. They're free. So, and they're anonymous completely. You don't have to give me any contact information at all. Go ahead, next screen. There's Kelly. And there's our suicide prevention lines, our Get Help line. If you are LGBTQ, the Trevor Project is great. You don't like to call anyone on the phone, it's okay. Crisis text line is here for you at 741-741. These are emergency numbers we keep in the deck anytime you all need them. Go ahead, and I think that's the end. I'll go ahead and give it to Dustin.
Marcy, we've gone a little bit out of order, so we are actually skipping ahead to housing, and I think Adrian is gonna, well, actually, I'm sorry, I'm now skipping. Kara's gonna give us a really quick update, and then Adrian.
Yeah, just so at-home testing updates, if you all requested your at-home testing from the USPS, you can now do that again. So starting today, this week, every household is eligible for 2 orders of 4 for a total of 8. So just so you know, like that's going to become sort of, I think, a recurring timing. They're not being forthcoming on what the timing is going to look like, but just so you know that if you already requested your 4 for your household, you're eligible to request 4 more for a total of 8 starting today. That's the news out of Washington. And then right now, we're just going to wait because child poverty has increased in Kentucky because we did not get the child tax credit extended because Build Back Better did not pass so far, but there is still hope that lives. Build Back Better is something we still very much so need. But we're waiting, and hopefully by next month, we'll have an update so that we'll know a little bit more about what the new version may be, because it does look like the current version that has been in waiting now for several months doesn't have a whole lot of momentum. I will point out that not much could happen in the Senate for the last month because unfortunately, I know a senator from New Mexico had a major stroke, but he came back just a couple of days ago, just 1 month after. So yeah, and then Christina put in the chat there that covidtest.gov. You can either go to USPS or covidtest.gov and get that next set if you haven't already, or if you didn't get your first set, you can get 8. And then Adrian is going to update us on some housing stuff.
Okay, great. And I will make it quick. Next slide, please. Just as a reminder, as folks need to access homeless assistance, we do maintain this spreadsheet and it gets updated quite a bit. So go ahead and check it out once you get the slide deck tomorrow. Next slide. All right, and we do have rental assistance in most parts of the state. We always talk about the balance of state, that is the Team Kentucky Healthy at Home Eviction Relief Fund. And then Lexington has its Housing Stabilization Fund. And then Louisville, we always defer to our partners in Louisville because they have a much better idea of the ins and outs and what is happening with rental assistance there. Next slide. Okay, with the Healthy at Home Eviction Relief Fund, you can see the month-over-month spending. It has peaked in October. That was when KHC, Kentucky Housing, was dealing with a lot of clearing out a backlog of applications. But overall in the state, $87 million remains available to assist Kentucky renters with back rent, future rent, back utilities, future utilities, and that includes internet. Next slide. And then this is the rental assistance eligibility, just some reminders there. Next slide. The big news since we last met is that the Housing Assistance Fund, Protect My Kentucky Home, has been rolled out, was approved by Treasury back in the winter. And so this will take you to protectmykyhome.org. Next slide. It is being administered by Kentucky Housing Corporation, but it covers all of the counties, including Fayette and Jefferson. Qualifying homeowners may receive up to $35,000 in lump sum assistance to repay delinquent mortgage bills, utility payments, insurance premiums, property taxes, and homeowners association fees. So a lot there. Funds will be available until they're fully expended or September 30th of 2025. And there is an income calculator on the website to see if you qualify. Next slide. You should be living in the home because you should not be asking for housing assistance for your third home, you know, out in the land between the lakes. And it also talks about other qualifications for the program. Next slide. All right, turn it back to Emily.
All right, well, thank you everyone for hanging in there. And especially as we try to navigate these 2 separate parts of our agenda and having to run through these slides at the end, we will tighten this up for next month. But as Kelly said in the chat, all of the slides will be coming to you in a follow-up email tomorrow. All the materials that we shared in the chat or answers to questions. So you'll be receiving those along with an evaluation. We always like to know what you want us to cover in future webinars. And again, if you want CEUs, please let us know. I think all of the other information will be coming to you tomorrow. So we're going to wrap it up today. And thanks again to our guests from the Cabinet for Health and Family Services for joining us as well. And our sponsors for making sure that we can provide these webinars to you every month for free. Thanks everyone and have a wonderful afternoon. We'll be in touch.
Thanks for having me.